Back in the 60s and the 70s, you'd have people who would be fighting for the racial justice. And they would say that the whites who were helping them fight for that would be allies, right? And then you'd have, in the 70s, you'd have people who were fighting for the rights of folks who were gay or lesbian, and we'd say we were allies of theirs if we were not in that group, right? And then men would say, you know what, I'm standing up for the rights of women, and so we'd be their allies. In the healthcare reform, there's no allies. Everybody is in it. It is your business. And we've got to find ways to reach out to each other, because I'm telling you, without unity, we're not going to be able to be successful. So let's be tough on what a public option will be, but once we get it, we've got to have all shoulders to the wheel.
Yes.
Yep. That's right. All right. Zoe?
And we need to remind them that Jesus, when people came to him, the first thing he would do was heal them. And Jesus healed first thing and for free. So let's say that Jesus healed first thing and for free. So can't we just imitate that a little bit? And I have the wealth for health. The very wealthy people should care for, or pay a little bit for the poorest and the sickest among us.
My name is Maureen Hodges. I'm a retired physician. I was a cardiologist, a salaried cardiologist. I was a better doctor for it, actually. I'd just like to say I've been working for getting coverage for everybody for many years now, and I feel very strongly about it. And at a family gathering recently, my granddaughter, Zoe, said, "Grandpa, how strongly do you feel about it?" And I said, Zoe, I'd go to jail if I had to. I'd participate in civil disobedience and go to jail if I had to.
You know, hey, hang on, folks. I want you to know there were some docs who did civil disobedience in the Senate.
Make sure that that public option is there to pick up the piece for me, because I know that if I lose that insurance, I am going to be without. And looking at the bills and looking at the cost of my medication and the cost of my, the cost of just basically getting my care, I'd go bankrupt in, months without that option. So fight for that. Continue that fight. Thank you.
I would like to tell to the Senate and the Congress, the House, is I want the same health care that they have for my family.
Yep.
And if we can afford to pay for their health care, I think we can afford to pay for ours.
My name is Dalia Baez, AFSCME, Council 5, Local 722. I work at Regents Hospital in the patient accounting area, which we do billing. I talk to patients every day, and it's a sad world. It is, when we have our seniors can't go to the doctor to get their health care needs provided. They can't even go to a clinic, because if they don't have a copay, hey, we can't see you, so there they go to the ER.
Companies are paying 50% or less of the total care, and they're not covering most of the people. If you are on dialysis, you are on Medicaid. If you get a kidney transplant, the first 4 years of medication, you are on Medicaid, you are on public health care. And after 4 years, if you don't have medication, you're dropped. Many of these people need to have another kidney transplant because they can't get their medicines to continue their anti-rejection. I work in an intensive care unit. Many people come in, if you don't have health insurance but your life is in danger, you're on Medicaid right away because you get in intensive care. You get out of the intensive care, you don't get your medications, you don't have a clinic, you don't have a primary doctor that you go to, you're done, you're back in the intensive care unit again. It's wasteful, it's horrible. Thank you.
The people for keeping all this whole system private, they say, they use these scare tactics, you can't pick your own doctor, you can't do all this, you can't do that. Does anyone ever ask them if their plans can let you pick your own doctor? Do their plans guarantee you care when you get sick and that they're not just going to dump you out? Why don't we focus more something on that? When they hold the public standard to that, why not hold the private standard to that as well?
In the last year, I've had unplanned conversations with 5 different people from 5 other countries who have universal single payer. In all 5 cases, they have told me that what we are being told by our media about their system lies somewhere between gross distortion and flat-out lies.
We have studied this issue for 2 or 3 years with our Metro Independent Business Alliance, and we've been to a number of conferences, and we've had a number of people who've looked through all the numbers. And I'm very disappointed in what the Chamber of Commerce has been doing, because they consistently have been lobbying on the side of the insurance industry and the status quo. And clearly, I think everybody in this room knows that we need to change what is going on in this country with healthcare. And they're defending the status quo. I think one of the reasons that we're the only business group that is supporting universal healthcare and the Marty bill and HR 676, which is the John Conyers bill, is because we've studied them and we've gone out and asked questions and somebody besides the insurance industry in the current major media. So I think that the problem that what business has is that they've been grossly misled by their leaders, and Chamber of Commerce is one of those. So I think that there is information. The Physicians for National Health Plan, a doctor at one of the recent programs said, Dr. Letts said that we should be on the offensive because we have all the data, all the information, and the world experience is on our side, and we just need to do something about it.
Because the public option is not a public option, is not a public option. You have to look at it and figure out what they're talking about. If the public option gives subsidies to every single insurance company out there to cover everybody that's under 400% of poverty or whatever, I mean, that sounds great. That's kind of like S-chip, but it's not real reform, and we're going to be pouring public dollars into the industry that we're currently trying to fight. So I just think that's a really good point. Also a really good benefit package, affordable premiums, and a large pool, a large guaranteed starting pool of people. Because if the public option is small, it's not going to work. Thank you.
I usually don't like to draw hard lines, but I've drawn one, and I really mean it. I'm not voting for anything without a robust public option.
I don't trust the insurance company because I don't trust that business model for healthcare. Insurance is something we want to have but never need.
I was an insurance executive with Prudential and with several health plans. I'm a physician, and I taught family practice in Hampton County in the family practice department. And I want to say the most important thing is to show where we're going to save money before we go too far. And the best place to save money is to be able to negotiate with pharmaceutical companies on the cost of medication for all these programs.
All right.
They are making way too much.
Drug inflation has been going up by 9, 10, 16% a year. We need a universal plan that can use its power to purchase drugs at an affordable price like every other country in the world. That'll squeeze out money to help pay for reform.
Most businesses are being bankrupted by this, and there's no better place to look than the national headlines for the auto industry in this country that has been totally and completely destroyed. There was an article in the Nation magazine in 2004 by Morton Mintz, who talked with the CEO of North America from Daimler Chrysler, when it was Daimler Chrysler, who knew the executives from Ford and GM, and he said that he was for universal health care because they had it in Canada, and he made cars for $1,700 less per car. And they said, why did you talk to the GM and Ford executives? He said, I talk to them all the time. He said, why are they not doing this? It's going to bankrupt their company. He said, because of ideology.
$1,300 of each car is healthcare costs. That's what it is. Maybe it's $1,800 now, but it's a lot of money, and that's why it's not competitive. It's not the workers' wages; it's the cost of the healthcare.
If I were a insurance company executive, which I'm not, obviously, I would try and make the line of this battle be drawn around my ability to cherry pick, to push the unhealthy people into the government pool and keep all the healthy people. I would say, as a suggestion, as a favor, if you could make that the line in the sand, just like you do in a union battle where you don't end up with everything that you want, but there's some things that you can't have in your contract. Otherwise, you just have to draw the line. I'd say that's where you have to draw the line in this.
to stop paying for unnecessary procedures and start paying on a number of people use the phrase evidence-based care, and start doing that. And that will also make health care more efficient and have better outcomes. A public plan would lower the administrative costs that are now going to insurers. It's been pointed out by a number of speakers. By lowering the administrative costs, we can also increase, squeeze money out of the system.
If you pay by procedure, what are you going to get more of? Procedures. All right, right over here.
We've been told for the past 75, 100 years that if you're getting high-tech care, you're getting the best care. So that's what we expect. We expect to have a lot of those high-tech things done, and we need to be told, we need to be taught and have a new paradigm shift so that we understand. The example I like to use is that we can give you the best baby formula, but it's not going to, and pay as much as you want to pay for it, but it's not better than breast milk. And we have, physicians, no matter what the delivery is, they don't get better outcomes than midwives. So we need to learn that there's a different way to look at some of these problems, and that way we can expect different outcomes.
At the state and the national level, when legislation is passed, it's really important that barriers to people like nurse midwives, nurse practitioners, IVAL, it's removed, because we are not allowed in all states and across the country to participate fully within our defined scope of practice. If we add the almost 50 million Americans that are uninsured right now onto the rolls and we start taking care of them, it's going to take every single one of us, all healthcare providers, nurse providers, physicians, all of us working together to take care of them.
We need to overhaul the way we think about what healthcare is and how we use the services it can provide. For instance, the cost of producing doctors, nurses, and other providers needs to be reduced. It makes no sense that these people should enter their profession so deeply in debt that they are forced to charge insanely high fees simply to provide.
Challenge the socialist label. I think, it's really kind of crazy that we have people in Congress and we're paying for them and they're talking about socialism when their jobs are socialized.
Stop using the terms health care and health insurance interchangeably. They are two different but related things. Health care is a service received by a patient from, say, a doctor, dentist, hospital, etc. Health care is a service rendered. Health insurance is simply one of many ways to pay for services rendered.
There's actually been a lot of research and polling done on language and healthcare. And that's why I think you heard President Obama today talk about a uniquely American solution. That happened to be in my comments as well. You know why? Because it polls really well. It polls to about 70th percentile when you start like that. If you say words like demanding accessible quality health care we can afford for all, you poll over 70% of the public. If you use the word universal, you drop down to 50%, because all the enemies go ahead and say that. Now, it doesn't matter if I like that or we like that, but if we use the right words and we speak American, it's actually a book written by a guy named David Kuznets, it's called Speaking American. If we do that, then we can convince the public that they're with us. And it means that you said, sir, you said, brother, simplify the message. Use the right words. We actually produced in the union cards with the words to use, because you get better results when you use them. So I just want to share that with you all in terms of the message piece.
First off, I wanted to touch on the language that you guys were talking about, just using language that people can relate to. I'm going around talking to people 5 hours a night. You bring up universal health care coverage, and you hear, oh, so is that like what Canada's got, or whatever it is? Oh, people just aren't really informed on what exactly are we working on. And I think it's up to everyone in this room to not only talk to your friends, your family, and your allies on the issue, but talk to the folks that might not be completely aware and with us on this thing, because those are the folks that we're ultimately going to need support from to get things done. So,
who in here is willing to write a letter to our senators? Please do that. That is it. Who will promise to do so? Thank you.